You know, there are so many unknowns when it comes to the coronavirus pandemic, but what can we do right now with the information we do have, especially as a stay-at-home order could soon be in effect in Oregon? To help us out, we're joined this morning now by Dr. Crespo. He's a professor at the School of Public Health with OHSU and PSU. Good morning, doctor.
Good morning.
Well, thanks for chatting with us. Now, I know your expertise here is in public health, and the public part here really seems to be what we are having an issue with in America as we try to stop the spread and flatten the curve.
Yes, and thank you for the opportunity. I think at this stage, it's important that we stay at home. There are certain things that we have been told to do, especially about washing our hands, about not going outside, but not to actually not go outside, but actually to stay at home and try to get some social distancing.
Yeah, I want to ask you about the going outside part there. We've seen some crowds at the coast. We saw that over the weekend. We saw some crowds at some of the more popular parks downtown. But at the same time, we do have health officials saying, no, get outside, get exercise. That is important. So how can people do it the right way? What should they be watching here?
There's a social part of it and there's a biological part of it. We have a virus who spreads easily. We have a virus who doesn't know boundaries. So at this stage, what we want to make sure is that people keep a distance from each other. At the same time, we do need some fresh air. Actually, being outside is actually helpful and healthy, and getting some moderate exercise is also good. I think the key part is that people keep a distance. It's hard to know when somebody's going to come too close to you. And sometimes there are things that you cannot control. And then it might be too late by the time you find out that somebody's coughing over you. And that's why some of these measures might seem a little draconian. But at the same time, it's one of the a few ways that we have in order to be able to control people to stay at home.
Sure. So what do we know about this virus so far that people should really be aware of? I mean, when you have something new like this, you've probably got to figure out how it spreads, how we get it. What are some of the pieces that we have been able to put together?
The key thing is it's a virus that spreads easily, and this is one of the most problematic part of this specific virus. It doesn't seem to be very virulent. It doesn't seem to have a severe a disease on some people. On others, it's actually very dangerous. So the key part here is how do we avoid getting the virus into our own respiratory system. And what we know from this virus is it's so easy to go from one person to another. And the more we can do individually, but also at the community level, then we have to make some decisions because sometimes people do not exactly listen.
hmm Now, of course, all of this is going on at a time when it's still typically cold and flu season. So are there other public health concerns that people need to be aware of outside of coronavirus, even though it's like the only thing we're talking about right now?
Thank you for the question because life continues. The healthcare system continues to receive people who get sick. People do get heart attacks. There are strokes. There are people with the immune system compromised. There are people who are actually, as we speak, being diagnosed with different diagnoses like cancer, etc. So the healthcare system still has to work and do the same things that they had been doing for a long time. Now we're adding a a COVID-19 outbreak, which actually overwhelms the system. The flu, for example, season is not over yet. And if you haven't had your shot, you should probably go and do it because you could complicate things. You could have the flu and then be exposed to the COVID-19.
Yeah, and we've seen a lot of people coming in and getting these COVID tests that come back negative, and then you have to wonder if that is flu. So, yeah, coronavirus doesn't get you out of a flu shot. Still a good idea to get that this year. All right.
Yes.
Dr. Crespo, we appreciate your time this morning. Thank you so much.